I'm going to demonstrate the paralleling technique, periapicals in the posterior. I'll start by turning on the control panel. I'll make sure that I have the adult client selected for my adult Dexter. Film is selected. I'm using radiographic film. And I'll change the tooth icons, the pictures on the control panel, when I'm taking the premolar views. I have the same icon for both the maxilla and the mandible. For the molar views, I have an icon for the mandibular molar and a separate icon for the maxillary molar. I'm going to take, or we would take, 8 shots for the posterior with the paralleling technique. We would take a premolar view and a molar view for each quadrant. I'll demonstrate the left side for the client. We'll start with the maxillary premolar view, and in this shot I will get the distal half of the cuspid or canine and the premolar teeth. For the molar shot, I will get the distal half of the second premolar and the molars. And we do that for each of the 4 quadrants. I'll first get the instrument set up. I have the rod, bite block, and ring for the posterior. The rod is inserted in the side of the bite block, and the ring is placed so that the block is in the center. I'm using size number 2 film. The dot is placed into the slot of the bite block, and the tube side is toward the ring. With this instrument set up, I'm ready to do either the second quadrant or the upper left for the client. I'm also ready to do the lower right or the 4th quadrant. For the upper left or second quadrant, the film is placed with distance between the teeth and film, making sure that the film is on the lingual and capturing the distal half of the cuspid or canine. The block is up against the teeth that we're imaging, and the client closes. The ring is brought close to skin surface but not touching. And the tube head and PID are brought in flush with the ring so that we have the correct horizontal and vertical angulation. I would then exit the room to expose this film. For the molar view, again, the film is placed parallel to the long axis of the teeth, making sure that the film is on the lingual or behind the distal half of the second premolar. The block is up against the teeth that we're imaging, and the client closes. The ring is brought close to skin surface but not touching. PID is positioned so that it is flush with the ring for correct horizontal and vertical angulation. I need to select the molar icon for the maxilla, and I would exit the room for exposure. For the mandible, staying on the left side of the client, I do need to change the instrument. I'm going to remove the rod, place it on the other side of the block, and also adjust the ring. Again, so the film is in the center of the ring. I'm now ready to do the 3rd quadrant, or the client's lower left or the first quadrant, the client's upper right. I'll start with the premolar on the mandible. So again, I'll change the icon to premolar on the control panel. The film is placed away from the lingual side of the teeth. I'm positioning the film parallel to the long axis of the teeth, as well as imaging the distal half of the cuspid or canine. The tube head and PID are brought in, and the ring is nice and close to the client. The PID is positioned flush with the ring for correct horizontal and vertical angulation. I would then exit the room for exposure. For the molar shot, I'm going to place the film away from the teeth. I want to image the distal half of the premolar. The film needs to be, again, parallel to the long axis of the teeth that I'm imaging. The ring is brought close to the client's skin surface, but not touching. Tube head and PID are positioned flush with the ring for correct horizontal and vertical angulation. And select the correct tooth icon for this exposure and exit the room for exposure. This is posterior periapicals for the paralleling technique.